I think we can probably make it work. Well, thank you so much for that introduction. And I was just saying, of course, I'm pretty sure we'll be able to make that work. I can't imagine a better place to have an E-2 rally than right here with all you amazing folks. So I want to begin, of course, by acknowledging that I'm so pleased to be joining you here today on the traditional territory of Treaty 6, and to also recognize the Métis people of Alberta who share such a deep connection with the land on which we are all meeting. Thank you, Leanne, for that wonderful introduction. I hope your voice gets better soon there, Mike. And I also want to thank your entire HSAA executive for your dedication and for your strong advocacy on behalf of your members. As has already been mentioned, I'm so pleased today to be joined by my colleagues, Christina Gray, David Shepherd, Heather Sweet, Chris Nielsen. And I also want to acknowledge another special guest in the room. And I think I'll probably make him blush just a little bit, but a big round of applause for our candidate for Leduc Beaumont, Cam Heenan. And Cam, I think, if you could just stand up, Cam will be going around to each and every individual table with a hat, passing the hat. And for those of you who are worried you don't have cash, don't worry, there's multiple ATMs in the lobby. Welcome to the team, Cam. This is what it's like. No, I'm just kidding. We'll wait for you to get elected before we ask you to publicly humiliate yourself like that. But don't worry, it will happen. Nonetheless, like you getting elected, that's what I mean. It's going to be exciting. It is so great to be here at the Health Sciences Association of Alberta's annual convention in person this year. Such an amazing and wonderful change. Last year, I'm sure you all remember, we were all huddled around our computers looking at little tiny boxes and doing our best to celebrate your landmark achievement. 50 years of HSAA's advocacy and strength. And let's say, given that we were online, it wasn't really the rager that we all thought that such an event really deserved, especially because most of you were on mute. But at the time, I promised that next year, i.e. now, I would be here to mark the occasion. And I'm very happy to be able to be with all of you to do that today. And while we are technically 51 years since that first group of just 11 members came together, it's exactly 50 years since your first bargaining unit. HSAA began representing paramedics at the MIS in Edmonton in 1972, which was actually just a few years after the MIS had first opened at that West End site. And fast forward to today, and construction on the new Misericordia Emergency Department on that same location is nearing completion, finally alleviating serious space concerns with an ER 3 times the size of the current one, adding 40 new treatment spaces and 6 ambulance bays, all to better support the paramedics and specialized health professionals who work there today. And our NDP government was proud to fund and build that project, listening to the many voices and the feedback of the health professionals who were working on that site and still are, including many of you. Now, I say this not to toot my own horn on hospital infrastructure, although, okay, maybe I will do that just a little bit, but more seriously, because that project is actually rooted in the history of advocacy, leadership, and growth in both your professions and this union. 50 years from just 11 paramedic techs to today, a multi-specialized, multi-discipline union that is 29,000 members strong. For 50 years, you have rallied around the fight for public health care each and every time it has come under threat. And now we come together to look at the next 50 years. The theme of your convention, our union, our future, and that's a little bit about what I want to talk about today. Because about a year from now, Albertans will get their say in their future. And with your help, healthcare will be on the ballot. Now, my team and I are determined to present a different future for our healthcare here in this province, one that cuts the chaos and funds the front line. Because you deserve a government that actually has your back, that understands the work that you do, now more than ever. You know, this pandemic has been devastating. After 2 years, I know many of you are exhausted and burnt out and worried that that day is coming when you might not be able to go on. You've been celebrated for doing your job and then attacked for doing your job. And you've experienced more sadness and death than ever before. And I know it really has not been easy. So to all of you here today, you have served. You have served Albertans with strength, with professionalism, with duty. And all Albertans owe you their respect and their gratitude, not just when the cameras are on, but every day going forward. Healthcare workers have performed heroically. But this UCP government, well, I got to tell you, I'm not going to mince words, they've been a crushing failure. Their incessantly ideological need to hollow out healthcare left Alberta more vulnerable to COVID-19. And their refusal to take the virus seriously led to a fourth wave that very nearly collapsed the entire healthcare system and may still yet. The highest per capita hospitalizations in Canada, tens of thousands of surgeries canceled, and a government more concerned with vacations than vaccinations. In fact, yesterday, they officially shut down the legislature to go on a multi-month-long exercise in one of their favorite pastimes, infighting and admiring their own navel. Meanwhile, there are 21 communities across this province where hospitals are partially closed due to staff shortages caused by this UCP government. And you can't deliver a baby in hospitals in Barrhead, St. Paul, Sundre, Three Hills, Provost, Wainwright, or Whitecourt. There are wait times for children at the Stollery Children's Hospital and actual lineups outside the Alberta Children's Hospital in Calgary just for triage. And according to the government's own figures, Alberta's lost 140 doctors last year alone. You can't find a family doctor in the Bow Valley, and there are 40,000 people with no family doctor in Lethbridge. In Red Deer, we saw 14 ambulances backed up in the hospital parking lot. Now, I'll speak a bit more about EMS in a moment, but we know ambulance wait times in urban areas are the longest that they have ever been. And paramedics are overwhelmed. The system is in crisis, and the UCP, well, they're on summer vacation. It's tools down, they're off the clock. So yeah, I agree with the member who spoke up here from the floor yesterday. Maybe it's their time off that Albertans should deny. Because instead of taking responsibility and showing a little teeny-weeny hint of remorse, we instead have a premier and a cabinet who attempt to gaslight Albertans on these issues daily, just so that they can cater to the extreme fringe of our society. And this failure in leadership, my friends, it rests not just with the premier, but the entire UCP government. And they know it, which is why they are doing everything to pass blame on to someone else. For instance, right now they're focusing on trying to throw the blame on AHS. These guys are getting ready to pull their biggest trick yet, convincing Albertans that the answer to COVID-19 is actually to cut and to privatize healthcare, because somehow that's going to make sure it's run better. The UCP claims health spending is up, but let me tell you something. You probably know this, you see this every day in the work you do. That is not true. If you take what was spent last year in our healthcare system and compare it to what was actually in the budget for this year, we are down by $800 million. They keep drip feeding funds and playing a shell game, acting too late and investing too little, and then lying about it. But here's the real truth. They want public health care to fail. in order to justify dismantling it in a way that Albertans have never seen before. At a time when we need to be supporting frontline workers, they're actually accelerating plans to reorganize. And as I said, all that means is more chaos, more cuts, more private health care. Right now, the UCP is treating our beloved healthcare system like a giant game of Jenga. You know, the game with the tower of blocks? And they're poking at the core foundational pieces of healthcare and seeing how many they can remove. Emergency response? Poke. Doctor availability? Poke. Frontline care? Poke. Fair wages? Poke. Friends, we know how this game ends. It ends in collapse. And so I am here today to tell you that my team and I will do everything that we can to stop this from happening. Alberta's NDP is going to fight to protect public health care, and if we are elected, we will go even further. We will reinvest in frontline health care, building new hospitals, boosting surgical capacity, increasing access to mental health supports, and all that will be done within a strong public health care system, attracting and we will work to attract the best healthcare professionals from around the world instead of chasing them away. And we will work diligently to recover from the damage of the UCP and do everything we can to stop it from having generational impacts. And as I've said, we will stop the plan to privatize our healthcare. And we know part of that is supporting frontline healthcare workers in all aspects of healthcare, because we know healthcare is much, much more than doctors and nurses. It's respiratory therapists and X-ray technologists, pharmacists and psychologists, paramedics and clinicians, dietitians, social workers, geneticists, medical scientists, lab assistants, clerks, facility workers, and so many, many more of you. You are all foundational to our better healthcare in this province. And we know that without you, the system just doesn't work, which is why we are fighting for all of you. Now, having said that, I do want to speak specifically to EMS for just a moment, because we are seeing signs of a mounting crisis. There are more Albertans struggling with mental health and addictions issues today than at any point in our province's history. And in the face of multiple challenges, including 2 years of COVID, growing mental health issues, and a worsening opioid epidemic, call volumes, we know, are at an all-time high. The pressure is so intense that dispatch is sometimes forced to hang up just to get to the next call. At the start of this month in Calgary, an obscene benchmark, 40 911 calls pending, each of them an Albertan in urgent need, waiting on hold. And I'm hearing from paramedics and dispatch operators who say they are assigned so many calls, they are not able to eat lunch or take a bathroom break, let alone decompress and emotionally process the stress of the day. More are burning out or choosing to leave the profession. Mike tells me how new paramedics aren't being trained up fast enough to match the numbers who are leaving. And across the province, as many as 400 shifts are unfilled at the start of every week. And what does this mean for Albertans? Well, red alerts, more times when there is simply no one left to help. In fact, the data shows the number of times there were no crews available to respond in Calgary went over 3,200 times last year. In Edmonton, we saw 348 red alerts this January alone. And while those are numbers, each of them represents an Albertan in need, and it also represents stress and heartbreak for the first responders who feel such responsibility to their communities. Last month, I was in Canmore, and our party stood with a paramedic named Kristen Buck, and she spoke about the crisis in care in the Bow Valley and how she had to foip her own government just to understand the extent of the problem. And she found there were 133 patients with a delayed response last year. She said there were 32 shutdowns compared to just 3 in 2019. And for the first time ever, ambulances spent more time in Calgary than they did in Canmore. And she talked about a patient who waited 33 minutes for an ambulance while in cardiac arrest. And as she spoke, I could hear the stress and the concern in her voice. This can't go on. Now, I know that all these issues also are not new. And certainly, our NDP government, while we made some progress, we did need to do more. And I want you all to know that we know that and that we hear you. And we understand you don't want another 10-point plan, you don't want another committee, you don't want an interim report on the interim report. You want action, you want help, you want boots on the ground. No more forcing professionals into casual, part-time, 89-day contracts where first responders are treated as expendable shift workers without benefits, pensions, or guaranteed hours. So, if an NDP government is elected in 2023, we will hire paramedics and dispatch operators who are full-time, dedicated workers. We will act with urgency to recover existing staff and recruit new ones. We'll reinstate harm reduction programs that ease the burden on EMS and better prevent those overdoses and save lives. And we will put more help in the ER so that when you pull up at the emergency doors, there are staff to take that patient. We want you back on the road doing your job, saving lives and supporting families so that when you get off shift, you have a life and you see your family. Because overall, here's the thing, we can't have a stronger frontline care without stronger frontline workers across the board. And that means treating people with dignity and with respect, recognizing the importance of their work. Now, this government anticipates billions and billions of dollars in new revenues this year alone. But after 2 years of overwhelming stress, how are you rewarded? Well, they want you to take a 10% wage cut. I mean, you know, it's ridiculous. These guys are also, as it turns out, on the hunt for a next president and CEO of AHS. And if we're not careful, that person at the top is literally going to be Mr. Burns, because somehow these guys think that's a good choice. The UCP, you know, they talk about getting a fair deal, but tell me, does that sound like a fair deal to you? I'd say no. They like to cite the idiotic McKinnon report. And don't get me started, I could go off on that for a really long time, but they tried to cite it to say that Alberta's healthcare system is underperforming against the rest of Canada. Now, it's wrong for 1,000 reasons, but nonetheless, what they argue is that we need to make cuts to be, quote, more efficient. They use coded language like that, but you know what more efficient really means. Lower pay, longer hours, fewer benefits. And when Jason Kenney says Alberta is back, or any of the new leadership hopefuls say Alberta is back, it's pretty clear what they really mean. Back to disrespecting workers, back to avoiding responsibility, back to underfunding frontline care, and back to attacking the unions who speak up on their behalf. And I want to tell you this, that our party will be back to govern a different way. We will defend the rights of working people at every turn, or put another way, your right to come together to secure the wages and the benefits that you deserve. You deserve safe and family-friendly workplaces. You deserve respectful negotiations. You deserve fair pay and benefits that reflect the value of your work. So under any government that I lead, working people will be treated with respect and humility. We will restore health and safety rules, and we will put the worker back in workers' compensation. We will respect your constitutional right to organize and your right to free speech. And you know what? We will kill Bill 32. You know, my friends, we can't grow the economy off the backs of healthcare professionals who feel let down and left behind. We need to raise you up. So no more picking fights with frontline workers, no more demonizing unions and silencing your voice, no more bad faith bargaining. We will always approach you with respect for the work you do for Albertans as Albertans, because that is what you deserve. So before I end my remarks today, I want to thank all the members, the stewards, the staff, and the senior executive officers of HSAA who are standing together in solidarity. I want to once again thank Mike for being a strong advocate and for standing up with me just recently to fight for EMS. I know Albertans are counting on us to be the practical force for progressive change and compassionate change in this province, to get back to focusing on what matters to Albertans. And every single day, I have to say, people now come up to me when I'm walking around or just living my daily day. They say, Rachel, we need you back. This government is doing so much damage. And I always reply, yes, I agree. But this is a group project, my friend. I cannot do it alone. My caucus cannot do it alone. My party cannot do it alone. We all need your help. So I ask all of you, as we get closer to the next election, as in tomorrow, starting tomorrow, keep raising your voice, keep fighting for healthcare, keep raising the issues and the solutions. Don't stop organizing, don't stop talking to your coworkers, don't stop talking to your neighbors and your relatives and perfect strangers also. Please also talk to them. And while you're doing that, fight for fairness, for equality, and a better future for our province. And I promise you, if you do all that work, Alberta NDP will be doing it alongside you as well. Because when working people come together, we can make this province a better place. 50 years in solidarity, and here is to 50 more. Thank you so much, and I hope you have had a wonderful convention. Thank you all so much for all the work that you do. Thank you. Lovely. What's that?
A little token from us for coming by.
Thank you so much for watching, and to learn more, check out albertasfuture.ca.